Bill's been very much on the forefront of change in the healthcare industry for decades, really.
One of the top challenges that Dr. Jessee has tackled head-on is the issue of administrative complexity in healthcare.
Our system is riddled with inefficiencies, excessive administrative expenses, inflated prices, inappropriate care, waste, and yes, fraud.
To raise awareness of the issue, Dr. Jessee authored a comprehensive paper on the topic, which served as his submission for ACMPE Fellowship in 2003.
That paper led to a multitude of projects, including the creation of the Healthcare Administrative Simplification Coalition.
Another top priority for Dr. Jessee is the practice administrator's role in patient safety.
It's not enough to have skilled health professionals. You have to have a system of care that allows them to practice their professions in the safest and highest quality manner.
He has testified before
possible.
Congress on several occasions, lectures frequently on healthcare issues, and is the author of more than 90 scientific articles, books,
He
and
has
book
helped
chapters.
to craft meaningful solutions that I believe will lead to some of the best days ahead for our
We've
industry.
made the comment several times that regardless of what happens in Washington, health reform is occurring in the country. That it's delivery system reform, financing reform is taking place in the private sector. The federal bill probably accelerates the pace a bit, although a lot of it is still out there in the future. But delivery system reform is occurring all over the country already. If we really hope to introduce some degree of consumer choice and competition, let me push back a little, Jim, on the car analogy. I would take the position that what really started the quality revolution in autos was when the feds started dictating that every new vehicle should have a sticker on the window that had standard information on the sticker. And you could then actually begin to comparison shop and look at the features of one vehicle compared to another. You can now go online to Edmunds.com and you can pick the 4 cars you want to profile, but you can do it because there are standards as to what the measures are. We haven't gotten to that point. We're moving in that direction, but if we really want to have an empowered consumer base choosing amongst physicians or healthcare organizations, it's going to require some standardization of the measures. A number of people have asked questions about accountable care organizations. I've started referring to them as ACOs, standing for Any Consultant's Opportunity. But clearly that's the hottest item on the block right now. We all agree that more accountability is important, more coordination of care is important, and the whole idea behind accountable care organizations, I think I've heard everybody say, is to transfer some of the risk, which is now borne almost entirely by the employer and the insurers, onto the provider community. You can structure an accountable care organization with a little bit of risk just by gain sharing based upon quality metrics, but maybe a little more risk with some bundled payment and a lot of risk if they're capitated. But if the provider community starts becoming organized and risk-bearing, what the hell do you need an insurance company for?